Thank you for joining us. My name is Quinton Friesen, and this is Module 3 of 15 in 4 Essential Disciplines, a training guide for healthcare leaders worldwide. My colleague, Ken Hekman, and I are going to lead you through 15 modules to help you improve your knowledge, skills, and attitudes as a healthcare leader. This is Module 3 of 15. Today, we are beginning a conversation that will assist us in focusing our organization. That is, pulling our resources together in order to achieve some stated objective. Edward Deming, 20th century management professor, talked about constancy of purpose, or being continuously focused on purpose. Today's session's objectives are to introduce the concept of mission, vision, and values, and to define those terms with illustrations. How to identify organizational issues and challenges to determine techniques that can be used to assess issues facing an organization. Time management, to understand the difference between important and urgent. And finally, strategize, to understand techniques to take action moving the organization forward. Let's define some terms.
Quinton, what is a mission?
The dictionary defines mission, the business with which a group is charged. An organizational mission statement answers the question, why do we exist? What is our purpose? Another way of expressing the mission statement is to complete the statement, we exist for the purpose of. One hospital that I'm familiar with, organized in 1865, had in its original documents this statement, we care for the sick and injured, provide medical education, and conduct medical research. Nearly 150 years later, the mission statement has been unchanged. Research says that the best mission statements are clear, concise, and memorable. It has been reported that the top 50 mission statements averaged about 15 words.
Here are some examples of mission statements. The Juvenile Diabetes Research Fund says, our mission is to find a cure for diabetes and its complications through the support of research. The American Heart Association, to build healthier lives free of cardiovascular disease and stroke. The Cleveland Clinic says, to provide better care of the sick, investigation into their problems, and further education of those we serve. So as we have seen, the mission statement answers the question, why do we exist?
What is a vision statement, Ken?
A second key document that will help you focus your organization is the vision statement. The dictionary defines vision as a mental image, the ability to perceive something not actually visible through mental acuteness or keen foresight. It describes a future state of being, or it describes a mental image of the future. It pulls us into the future. A well-known teacher and public speaker describes vision as being dynamic. It creates movement. It sets direction, demands discipline, consistency in focus and action. It requires determination. It must be durable. If it is lost, the organization will stumble.
Some years ago, my family and I visited South Africa. While we were there, we visited Robben Island, where Nelson Mandela was imprisoned for many years. Upon our return, I read Nelson Mandela's autobiography, The Long Road to Freedom. Nelson Mandela's vision was to see an apartheid-free South Africa. For years, he worked with others to clarify that vision and to gain support for his vision. He encountered incredible resistance, spending 27 years in prison. During his years of imprisonment, he kept his mind sharp. He worked out daily and built a network of support within the prison, never losing his vision of an apartheid-free South Africa. As the struggle continued, he began to gain international support for his vision. He never gave up, And then the most unlikely thing happened. The South African government began to negotiate with him. They knew the current situation could not continue. There had to be a change, and Nelson Mandela represented the person who could negotiate that change. Nelson Mandela's clear vision, his persistence, his tenacity, and willingness to pursue freedom at any cost eventually led to fulfillment of his vision. He never gave up. He was willing to go the distance to see his vision fulfilled. You can see the power of vision. That's the power Ken and I want to unleash in your organization.
Let's look at some examples of vision statements. First, from Sharp Healthcare, San Diego, California. Sharp Healthcare's vision is to be the best healthcare system in the universe. Sharp will attain this position by transforming the healthcare experience through a culture of caring, quality, service, innovation, and excellence. Henry Ford Hospital in Detroit, Michigan says this: transforming lives and communities through health and wellness, one person at a time. Once your mission and vision statements have been developed, you will want to develop your statement of values. How do you develop value statements?
Again, the point of each of these activities is to focus the organization. You will find that as these documents are developed, that is your mission, vision, and values, and integrated into your organization's culture, people will begin to respond to them. They set the direction of your organization. The dictionary defines values as that which is desirable or worthy of esteem for its own sake, the social principles, goals, or standards accepted by an individual. Values describe what the organization holds as being valuable, what we hold dear. We would be willing to stand up for these regardless of the circumstances. One writer said, "This is what we are willing to fight over." They are a statement of core belief. Values describe how we treat one another. They describe a code of conduct, how we do our job. Hospitals and healthcare organizations hold values that govern their behavior. They define expectations to the staff, to the physicians, and present what the organization stands for to the community.
Here are some examples. The Mayo Clinic in Rochester, Minnesota says, respect is a key value. We will treat everyone in our diverse community, including patients, their families, and colleagues, with dignity. Compassion. Provide the best care, treating patients and family members with sensitivity and empathy, which is feeling for another. And they describe integrity. Adhere to the highest standards of professionalism, ethics, and personal responsibility worthy of the trust our patients place in us. There are more examples in the published statement, but this gives you an idea about how to construct a values statement. Here's another example. Quinton?
Intermountain Healthcare in Salt Lake City, Utah, has 4 values. The first is mutual respect. We treat others the way we want to be treated. Accountability. We accept responsibility for our actions, attitudes, and mistakes. Trust. We act with integrity and can count on each other. And finally, excellence. We do our best at all times and look for ways to improve. Once your department or your organization's mission is determined, the leader can begin to assess what are the challenges or issues facing the organization. In this process, you are comparing your mission and vision with the current situation. We call this a gap analysis. There are numerous techniques that leaders can employ to make this assessment.
One of those models is called the challenge model. This model, discussed in the book Managers Who Lead by Management Sciences for Health, measures the organization against its mission and vision statements. To conduct an analysis using this technique, follow these steps. First, review your organization's mission and strategic priorities. Create a shared vision. Agree on one measurable result you want to change. assess the current situation, identify root causes and obstacles, define your key issues and select priority actions, develop an action plan, implement the plan, and monitor your progress.
Another technique that organizations used is referred to the fishbone diagram, or cause and effect diagram. This analysis is designed to help leaders identify and explore possible causes of a specific problem. For example, the leader examines policies, processes and procedures, people, and the environment, asking the question, why does this happen? What we are doing is we are analyzing the causes of a problem that result in a particular effect.
We've talked about focusing the organization. It is important for the leader to focus their time and energy as well. Everyone feels the pressures of time, things to do, people to see, job responsibilities, personal time commitments, and family. They all pull on us, often in opposite directions. Time management is a skill that anyone can master.
Understanding simple rules and discipline will get you on your way to time management. Time management steps include starting with a calendar. It can be ruled out on a sheet of paper. You can buy a printed one, or today you can buy an app for your cell phone. Make a list at the beginning of each day of all the things that need to be done that day, and then prioritize each item according to urgency and importance. For example, items that are urgent and important. The task is important to your job and it needs to be done today. For example, a report to your boss for a meeting that's scheduled this afternoon. Important but not urgent. The task is important to the successful performance of your job, but the deadline is a future date. An example would be explaining why you have a budget variance at a meeting scheduled next week. Urgent but not important. There may be pressure to do the task today, but it is not important to your job. For example, let's say you're meeting with your staff and the telephone rings and there's an interruption, potential interruption in your meeting. You make the decision to talk with your staff and not answer the telephone because your priority is your staff. And finally, there are items that are neither urgent nor important. These should not be on your list at all.
Pursue items on your to-do list according to the priorities you have set. Focus first on A's and B's, those that are urgent and important, and eliminate as many of the C items as you can. So there are a couple of keys to success in time management. The key really is to determine the difference between urgency and importance. And this requires personal discipline.
As you can see through this session, in order to focus our organization, we have focused on mission, vision, values, and time management. Key to focusing the organization is writing a clear and concise mission statement. Second is to develop a powerful vision statement. This will motivate your people to achieve the mission. Third, think through your organizational values. These aspirational values motivate the organization and its employees because they know what is expected and how they are going to be treated. Fourth, we need to assess issues, challenges facing our organization in its current context against the mission and vision that we have written. Where are the gaps? These become our agenda. Then finally, develop a plan to overcome the obstacles facing the organization. In summary, all of these steps work together to enable you to focus your organization.
So let's ask a few questions. Our mission, vision, and values don't seem to be reflected in our organization's performance. How can we recommit to them?
I think the first point, Ken, would be that leadership needs to be committed to developing and implementing a mission, vision, and values statement. Without leadership from the top, it is very difficult to change the culture of the organization. The old phrase, leadership comes from the top, seems appropriate. Second, leadership needs to gain buy-in by the entire organization, from governance to staff members and physicians. Third, the organization is managed according to its rewritten mission, vision, and value statement. It becomes a guide for action and behavior.
How about this one? My work is unpredictable and constantly interrupted. How can I manage my time with so many interruptions?
I think the starting point is that the manager needs to take control of their schedule. Start by prioritizing your work according to its importance and urgency. It's not dissimilar to a medical emergency. Medical practitioners are very deliberate in the manner in which they respond to a medical emergency. The manager is also similarly deliberate and decisive, taking action once and then moving on to the next issue. It's also a matter of training your staff to use the same model for their schedules.
That concludes Module 3 of 15.